Hello everyone, welcome to today's webinar, Integrating Adolescent Substance Abuse Screening, Brief Intervention and Treatment Throughout Nursing, Social Work, and Interprofessional Education. I'm Tracy McPherson. I'm going to be both your webinar moderator today as well as one of the speakers. I'm a senior research scientist in the Public Health Department at NORC at the University of Chicago. I'm also the Evaluation, Training, and Technical Assistance Lead on NORC's SBIRT projects, including the National SBIRT ATTC directed by IRETA. I direct several different learning collaboratives, one you're going to hear about today, which focus on improving access to screening and brief intervention and referral to treatment, as we fondly call SBIRT. For the past, 15 plus years, I've been leading substance use, mental health prevention, and early intervention projects that are funded by government agencies and foundations, and really working on translating research into practice, assisting medical and behavioral health organizations implement clinical practice that's really informed by clinical evidence, and to really work to build workforce capacity, both from a pre-service education, working with the future workforce that are currently being trained in academic and other institutions, as well as in parallel working to train the current workforce. So I look forward to highlighting the work that our partners on today's webinar have been doing with us, and things they've also been doing independently of our work together. And thank you again for joining us. I hope you enjoy our speakers today. This webinar and all of the webinars that are in our 2016 webinar lineup that are part of the Brief Intervention Group, or the BIG initiative, are produced in partnership with a number of organizations, including NORC and the National SBIRT ATTC directed by IRETA. You can learn more about our partnership and the different organizations and all of the activities that they're doing through going to our sbirteducation.com web portal, where you'll be able to access all the different links to the different organizations and their projects. And I'll show you a little bit of that later on in the presentation. So this is the second webinar in our 2016 SBIRT webinar series. We've already launched one in January. I hope you'll take advantage of that. That's now on demand. And it was really a mini guide, an overview to SBIRT, and many, many, many resources, many freely available to you. So I hope you'll visit our website. The website address at the bottom is where you can access information on any of these webinars, including the on-demand versions of any of these that we'll be hosting throughout the year, and also where you download resources and other materials that complement these topics. As you can see, coming up in March, we're going to have two webinars. The first one in March on the 9th is from the Trust for America's Health, which is a report that was released on reducing teen substance misuse, what really works. And also in March, we'll be talking about gambling screening, a topic that many are newly becoming aware of, but is really getting a lot of great interest. And then when you get into the spring and just before we get into summer, we'll be highlighting work around how to integrate motivational interviewing education techniques that you would use in brief intervention into curriculum, as well as how to use case studies in integrating those into curriculum that are focused around screening and brief intervention. And last but not least, we're very excited to bring a new topic, something that's very popular right now in talking about opioid misuse prevention and intervention. We'll be talking about prescribing guidelines and intervention skills for nurses and other healthcare professionals to prevent prescription drug misuse. And then in June, we're glad to be able to offer one of the few evidence-based programs, the WINGS intervention model, focused on intimate partner violence and how intimate partner violence and screening and brief intervention come together, and some of the results that are newly released in the field. So please take advantage of these, share this information. They're all available free and on demand after they are done live. You can access all the materials for today's webinar at the link that you see at the bottom of your screen. The PowerPoints are already up there. The materials and other resources are posted. That's also where you're going to find the on-demand recording. You'll also find links to the evaluation that you will be asked to complete after the webinar and be able to request a certificate of completion. We'll also have a Q&A session at the end, and I would guide you to be able to ask those questions through your pane up at the right-hand corner. At least that's where it is on my screen. There's a questions pane. You can, at any point in the webinar, you do not have to wait to the end. Go ahead and get your questions in, and at the end I'll moderate those, and we'll try to field as many of those as we possibly can. And then behind the scenes today is our technical facilitator, Misty Story, who is our technical consultant. And if you have questions, technical questions, and other kinds of questions behind the scenes, not directly to one of our speakers today, you're welcome to also use the questions pane, and she'll be able to field some of those for you as well. You also, for those who are on the live webinar today, will be able to get an email from her, a follow-up email from Misty, where you can also ask questions. So I want to acknowledge our funder, the Conrad Hilton Foundation, who has funded most of the work we'll be talking about today, but also our partners, the American Association of Colleges of Nursing, AACN, which will be speaking with us today, the Council on Social Work Education, or CSWE, also speaking with us today, and the Center for Clinical Social Work. So just as a quick overview of the webinar today, we are delighted to be able to bring CSWE and AACN to our webinar to speak about our collaboration together and some of the work they're doing independently. We have Susan Swider from AACN, and we have Darla Coffey from CSWE, who will both be speaking with you. We're going to provide a little bit of an overview of the project to give you some context about what we have been doing in collaboration. And then just highlight very quickly, not going into a lot of detail, but what is SBIRT and why adolescent SBIRT in particular, and then some of the challenges and gaps in education and some of the learnings we've had from working with our Learning Collaborative and our steering committee of experts in the field. And then we're going to have a presentation with our partner Cognito, a digital simulation technology company, who will also provide an interactive simulation demo of the platform that we're using, the learning tool. And then we'll have the Q&A and wrap up. So it's my pleasure to begin to start part one of the webinar with the Council on Social Work Education, or CSWE. I'd like to introduce Darla Spence Coffey. She is the current president of the Council on Social Work Education, and prior to her appointment as president, she served as a professor of social work, an associate provost, and dean of graduate studies at Westchester University. Dr. Coffey received her bachelor's degree from Eastern College, her master's in social work from the University of Pennsylvania, and her PhD from Bryn Mawr College Graduate School of Social Work and Social Research. She was a member of the social work faculty at Westchester University, beginning in 1998, where she contributed to the initial accreditation of the Master's in Social Work program in 2000, and she served as the director and the chair of the university's undergraduate social work program from 2002 to 2005. From 2005 to 2012, Dr. Coffey served in senior university administrative capacities, providing leadership for academic program development, curriculum, academic policies, assessment of student learning, transfer articulation, accreditation, and faculty development. During the 2008-2009 academic year, she served Westchester University as the interim provost and vice president for academic affairs. Her service activities within the university are extensive, including co-chairing Westchester's Campus Climate Intervention Team and serving as a founding member of the Advisory Board of Women in Leadership and Service. So it's my pleasure to be able to have Darla Coffey on our webinar today. So Darla, I'm going to turn it over to you and to hear about the work that you're doing at CSWE and the work you're doing with NORC on this project. So welcome.
Thank you, Tracy. I really appreciate the opportunity to join the webinar and hear actually about all of the good work that's going on. I wanted to just provide a thumbnail sketch of the Council on Social Work Education because lots of folks don't understand the breadth of what we do. So the Council on Social Work Education is on par with AACN in that we're the National Association of Schools of Social Work. Within CSWE's umbrella, we have the Commission on Accreditation, which accredits at the baccalaureate and master's level. We have 750 accredited social work programs, about 500 at the bachelor's level and 250 at the master's. There's also an additional 90-some doctoral programs, that would be the PhD as well as the DSW programs. We do not accredit them, but they're certainly part of the continuum of social work education. And in addition to accreditation, we do lots of stuff around providing opportunities for faculty and professional development. We've got our own journal, the Journal on Social Work Education. We have an annual conference in November. We're going to be in Atlanta for the annual program meeting. It's a fabulous opportunity for social work educators to come together and learn from each other. In fact, the theme for this year's conference in November 2016 is Advancing Collaborative Practice Through Social Work Education, which I just wanted to mention because that's really been a theme for me in my presidency here since 2012 to build on our partnerships and collaborations. And so we really want to highlight that at our next conference. I also just wanted to mention that we've fairly recently launched a new initiative which we call the CSWE Learning Academy, which is a pretty robust webinar platform for us to be able to provide additional curricular materials and teaching materials, program assessment materials for our programs. In addition to the accreditation and the faculty development, we've got our own institutes that focus on aging and international work. We do lots of work around supporting students at the master's and bachelor's level. We have a minority fellowship program to really advance the careers of historically underrepresented scholars and also practitioners serving historically underrepresented or underserved groups. And so those are some of the things that we're particularly proud of. Next slide. Thank you. One of the things that I wanted to mention in light of thinking about SBIRT with adolescents is just last month at the Society for Social Work Research conference in DC, the American Academy of Social Work and Social Welfare launched their Grand Challenges for Social Work initiative. If it's not something that you've heard about, I would encourage you to check out the website at AASWSW. I mentioned it, there's 12 grand challenges that are really going to, I think, galvanize social work education, research, and practice. And they're big, audacious goals like ending homelessness and stopping family violence. You could look at any one of those 12 and see that there would be a role for social work education to really highlight and ensure that all of our graduating students are competent in SBIRT for adolescents as well as adults. But I've highlighted here that there is one particular that's ensuring the healthy development of all youth. So again, that's a very broad goal, but it gives us an opportunity to link the SBIRT activity and the connections and the efforts that we're making here to one of those grand challenges. Next slide. So I just wanted to mention quickly, why we thought SBIRT was important to social work education. This was a no-brainer for me. I actually spent years in substance abuse treatment as a practicing social worker, and it occurred to me very early on when I began practicing in that space that it would have been extremely helpful if I had learned about how to recognize substance abuse disorders and problems in my social work education, because long before I started working in substance abuse treatment programs, I was working in the child welfare system, I was working with adjudicated delinquent youth, I was working with women at domestic violence shelters and their children who had been exposed to domestic violence, and substance abuse was often a factor or a dynamic in all of those different situations. And so I really felt like it would be important for us to, at the generalist practice level, be able to introduce SBIRT as a set of competencies for all social work students. Next slide. So we've been, actually, even before the partnership with NORC, there's been some movement within CSWE. We formed a social work SBIRT consortium for those folks that have been already practicing and educating and researching in the SBIRT space. You'll see that we have over 120 members of that social work SBIRT consortium. And so when NORC came to us and asked us to join in this partnership, we felt like it was a really important initiative to be a part of. And so there are also members of that consortium that have been involved in the SBIRT for Adolescents Learning Collaborative that Tracy mentioned earlier. Next slide. So I mentioned the Social Work SBIRT Consortium. For those on the phone or on the webinar that are not a part of it but are interested in joining that, there is Stacy Pruitt. She's Anastasia Pruitt, A. Pruitt at cswe.org. Would be happy to hear from you, and we would link you up with the 126 plus CSWE faculty that are very active in this space. And I just wanted to keep to my time. I'm a little bit over, but I thank you again, Tracy and Misty, for putting these slides together and for everybody's interest in this topic. I'm going to pass this on.
Yes,
so I can.
Yes, thank you, Darla. Appreciate you joining us and sharing what you're working on and about the partnership with NORC. And it's lovely to have you with us and working together, really trying to move this education as a part of routine education that we provide, not something that just sits over here and we sort of think about attaching it on somewhere somehow, but really trying to figure out with us, how do we integrate and weave this into the education for future social workers and those who are supervising social workers now and the educators. So it's really been a wonderful partnership, so thank you very much.
Thank you, Tracy.
Now we're going to move to part 2, the American Association of Colleges of Nursing, or AACN, and it's lovely to have Susan Swider with us today from AACN. Dr. Swider is a professor in the Department of Community Systems and Mental Health Nursing at Rush University in Chicago. Dr. Swider has practiced in acute care, home health care, and public health settings for the past 30 years. Her research is focused on program development and evaluation of community health workers and engaging urban communities in health promotion and health policy to support health promotion efforts. She has also taught public health nursing at the pre-licensure and graduate and specialty level at several universities and co-directed for 10 years of HRSA-supported work to develop an online doctoral program in advanced public health nursing, ensuring that it met the Quad Council competencies for public health nursing practice. She is a member of a number of public health and public health nursing organizations and is a past president of the Association of Community Health Nursing Educators, or ACHNE. In her role with that association, she has served on the Quad Council for Public Health Nursing Organizations and was a member of the task force that revised the competencies for public health nursing from 2010 to 2012. In 2011, Dr. Swider was appointed by President Obama to the Advisory Group on Prevention, Health Promotion, and Integrative and Public Health, a group designed to advise on the development and implementation of the National Prevention Strategy. She is also a fellow of the American Academy of Nursing and of the Institute of Medicine of Chicago. So I join me in welcoming Dr. Swider. Dr. Swider, I'm going to turn it over to you.
Thank you, Dr. McPherson. And I'm also join my colleagues in being very happy to be with you this afternoon representing AACN. I am having a hard time making the computer move here, but I'm sure it's going to, there we go. So for those of you who aren't familiar with AACN, the American Association of Colleges of Nursing, we are the national voice for baccalaureate and graduate nursing education. We're quite large. Nurses are the largest group of health professionals in the nation. So we have over 780 colleges and almost 500,000 students and about 18,000 full-time faculty that we work with on a regular basis. AACN is, largely has deans in the leadership position, but works with the entire academic unit. So faculty, staff, we have student groups and organizations, all the people involved in educating nurses for the future. Boy, I'm having such a delay on these slides here. I apologize. It's just not moving for me. There we go. So we set the standards for higher education in nursing and do a lot of professional development work with deans and faculty. We have an advocacy group that looks particularly at federal support and federal funding for programs in nursing education. We have a accreditation arm that accredits about 90% of all the baccalaureate and graduate degree programs. That's the Commission on Collegiate Nursing Education. And we have a certification arm that credentials clinical nurse leaders as a specialty in nursing. Our vision is really, it says improving quality of nursing care, but again, because nurses are the largest number of health professionals, we really think that if we could improve the quality of nursing care overall, we would go a long way towards improving the health of the public. And our specifics from AACN are that we work with nurses across the country to re-envision the role of nursing. It's, as a profession, evolved greatly from its early days and continues to evolve as the healthcare system grows and changes. We work to strengthen nursing education programs, to always be increasing the education of our nursing workforce and encouraging nurses to advance their education both personally and professionally. In terms of SBIRT, again, you know, I harp on this because I think nurses are so ever-present in our healthcare system. This is something of great interest to nursing and nursing education. Nurses are so often the first line to see clients, whether it's in the emergency room, whether it's in the primary care setting, whether it's in psych nursing, or with our ever-growing advanced practice registered nurse contingent, and that's nurse practitioners and nurse midwives and people who serve as primary care providers for patients. So the SBIRT model and approach is extremely useful, and we are often the ones who would be using that in clinical practice with a variety of people. So we're particularly gratified to have worked in collaboration with NORC and its partners on this project. We also have some additional work that we're working on with the Centers for Disease Control. So we have a cooperative agreement with CDC right now. It's about academic partnerships to improve health. And we are not the only organization to have this cooperative agreement. The AAMC, the American Association of Medical Colleges, has a similar agreement. The Association of Schools of Public Health has their own agreement. And the Association of Prevention, Teaching, and Research, APTR, all have collaborative agreements with CDC. So each of us works with CDC and also works with each other across those professions, with the focus being on improving or increasing and standardizing public health knowledge across all health professions. So CDC is very invested in making sure that all health professionals have a basic background in public health, and that's what these collaborative agreements do. They have many areas of focus. We fund fellows, we do interprofessional work on simulation and interprofessional education in public health, but most specific to the SBIRT approach is two what's called workforce improvement projects, or WIPs, that we have funded in the last year, one at Johns Hopkins University School of Nursing and the other at the University of Pittsburgh School of Nursing. And both of these are in using the SBIRT approach to looking at alcohol and substance abuse in primarily mothers and children. And so these are now web-based continuing education modules that have been completed jointly by these two schools and are now going to be rolled out for, I hope, very widespread use for nurses and others to use in their practice, along with continuing education credit for that, with the idea of reaching as many nurses as possible. So SBIRT is something that we think is very important in nursing practice, and we're happy to be involved in any initiatives that will help nurses learn more about this approach. So thank you for having us join us today, and now I'll turn it back to Dr. McPherson.
Thank you, Dr. Swider, and thank you for your partnership on this project. And we want to thank Dr. Joan Stanley, who works with us very closely on this project. And like CSWE, both organizations have played such a strong role in serving on our steering committee and helping guide us. And so it's nice to have you and Dr. Coffey on today. And so I want to now turn to part 3 of this webinar, and I'm going to be sharing with you a little bit more about this partnership and what we've been doing together. And it really is about working with and creating with the nursing and social work community of educators, field supervisors, field instructors, preceptors, practitioners, to really develop something together. It's an initiative that we see as a national initiative to work with as many schools of social work and nursing as we possibly can, and work to provide the curriculum, the materials, the resources that educators need to infuse screening and brief intervention around adolescents and young adults into the curriculum, and making it part of the education that we would expect and deliver in the future, so that the workforce is really prepared to enter the workforce, and the workforce is expecting that those new practitioners are prepared to do screening and brief intervention. So we have very high goals, and of course it does take strong partnerships for us to be able to do that together. Misty, could you advance the slide for me? So this project, integrating SBIRT into social work and nursing education, has really grown. Our goal was to really involve a minimum of 60 programs, shared across social work and nursing over 3 years, and we were wildly successful in that. In the first year, we had already begun working with more than 70 schools in the first year, and we expect that number to grow and grow. And if you are not part of the Learning Collaborative, or you know colleagues in other programs who are not, or you're interested, I really encourage you to join. Everything is that we do together is really about helping to create things that work for you and that you can use. And so it really is about bringing in the educators and the field placement supervisors, the preceptors, the practitioners, everybody, the different stakeholders, the associations, to really move this initiative forward. And so one of the things that we also want to do is to involve other stakeholders and experts, the subject matter experts in both nursing and social work and other disciplines happen to be very interested in this. They see the interprofessional nature of what we're trying to do, and they want to join us to help create a learning collaborative. We have also behavioral health organizations who have said, when we hire, we want nurses and social workers to be prepared to provide these services and be ready and skilled up to be able to do it on day one. We've also involved researchers who study, screening and brief intervention in practice and in education, and a variety of other stakeholders to come together to develop what we are essentially creating is what I call a curriculum. And in the curriculum is an instructor's toolkit. It can be called an educator's toolkit. It just could be called a toolkit. It's a toolkit for anybody who is trying to educate other people or train other people on how to do adolescent screening and brief intervention. So this toolkit has a variety of components, and we'll talk and share a little bit about that later. But this toolkit has a lot of resources that are made available to you completely at no cost. We're also engaging all the Learning Collaborative members and experts in what we call walkthrough calls to get to know what you're doing in your programs, what you want to do, what you haven't thought about doing but want some ideas on how to integrate adolescent screening and brief intervention education, and to really try to understand what do the programs look like, what do the courses look like, how are they structured, where could it be integrated, to really try to help provide some technical assistance on where it might fit, and so figuring it out together. We're also conducted a needs assessment in the social work and nursing education arenas, and we have a few results that we can share with you today. Really understanding your needs. You know, in the beginning I mentioned that we're developing things with you because we don't want to develop things for you. When people develop things for people, it never works out. If we don't understand your needs and get your voice, we don't know what to develop or how to develop it and shape it. And so that has been a really important piece, and we will continue to do that over the 3 years of this project. In addition to developing an instructor's toolkit, we have been working with our partners and the folks that that I've mentioned in the Learning Collaborative and the Steering Committee to develop together a simulation technology platform, which we call SBI with Adolescents. And my colleague from Cognito, Cyril Adam, will be talking to you more about what that simulation technology does, how to use it, and giving you a demo of that. And that has been a really interesting endeavor to create an educational tool that complements the instructor toolkit, that allows those learners to really practice the skills in a safe environment. And so we're very excited to able to bring state-of-the-art technology to the project. If you are interested in this project and interested in getting involved and meeting with us once a month telephonically, and any other of the activities you want to participate in as you see fit, I would encourage you to join our Learning Collaborative, and just email us at the SBIRT team at norc.org email address, and go to our website and let us know if you'd like to be a part of it. So the aims of the project are to engage the leading national associations, experts, the practitioners, the students, the researchers, and the accrediting organizations of schools of nursing and social work, and really to develop together and sustain a SBIRT learning collaborative with the schools of nursing and social work. And what we found, though, is it's even more interprofessional than that. Nursing and social work programs have reached out to other programs in their universities and colleges that are not in this discipline, but they're already doing interprofessional work with them, and they're developing implementation plans with those other disciplines. And so it's already extending beyond those disciplines, even though we started out focusing primarily on nursing and social work. And we're really trying to foster the partnerships and the collaboration, providing that technical support and the shared learning by highlighting on our Learning Collaborative calls what others are doing, what does it look like, what does it feel like, what are the challenges, what are the facilitators, and share that kind of learning to help people, work through how they might implement it in their own academic setting. And then, as I mentioned, developing those tools and the curricula and the toolkit and the simulation with all those stakeholders. And then, of course, to evaluate it, we've just launched a randomized controlled trial of the virtual patient client simulation program, and we are currently in the throes of that. And we look forward to continuing to do more evaluation with our Learning Collaborative. They're able to participate and in those evaluations. And so we're also learning not just are we changing knowledge, attitudes, and skills over time, but the qualitative piece of shaping what do these programs look like, what are some of the models for it, what seems to work better in certain situations. So we hope you'll stay with us, and we'll be sharing those learnings with our Learning Collaborative as we learn more. We have a stipend program, and we, of course, provide technical assistance. We have what we call a request for application, an RFA program, where Learning Collaborative members can participate or not, and they can still be a part of the Learning Collaborative, and they submit brief applications or grants that are reviewed, basically proposals, not grants, but proposals that are reviewed by us and by our partners at AACN and CSWE, and looking at designing a pilot implementation, and we provide stipends up to $10,000 to help support that. So that will be also a new RFA will be coming and be released in the next few months to be planning for the what I call the fall semester. And so you'll see more on our website, and we have a tab specifically dedicated and a page dedicated to the RFA program. So check it out. You can see what we proposed in the past, and I think it'll look very similar. So we hope that you'll join with us. So I'm going to talk very at a high level because we have a number of webinars that talk a lot about what is SBIRT, and the one in January talked a little bit about that, and we have others on demand for you. But so you understand in our context what we mean by screening and brief intervention, and what are we covering, how do we define it in our project. Essentially, we're using SAMHSA's definition. It's a comprehensive, integrated public health approach to the delivery of early intervention and treatment services for people with substance use disorders and those at risk for developing them. For me, I focus on the last part of that definition and those at risk for developing them. I think that sweet spot of SBIRT, the place where we have the strongest evidence and where we've done a better job, is in that place. And particularly when you're talking about young people, really trying to identify risk early, preventing ever the substance use disorder of ever occurring. And so in our model that we're using, we're talking about screening routinely using a valid, brief tool that is psychometrically sound and has been validated with adolescents and young adults. And it's the identification of substance use, which I define as alcohol, tobacco, illicit drugs, as well as prescription, non-medical use of prescription medications. We aren't focusing on depression or mental health, particularly in this project, but it is part of the model. And so for us, it's a validated tool like the CRAFT or the S2BI or some of the other tools that are available out there that are particularly designed for adolescents. When the tools that we're looking at and the ones that we include in our curriculum, they're designed to help the practitioner identify the level of risk. Not do they have a substance use disorder or not, but where are they on the continuum of risk? Are they at low risk, moderate risk, or high risk? For young people, many would argue that any substance use is risk. And so you have to tweak the model a little bit because the recommendations are for young people that no substance use is really the guideline. And so is there really such thing as low risk with young people? Some tools suggest that there are. Other tools say, any use is risk. So we take that into consideration, and we talk about that in the curriculum resources that are available to you. And so we also talk about in this project, and we are putting into our curriculum, what does a brief intervention look like for someone at low risk, or someone at moderate risk, and for someone at high risk? Is it a brief intervention that uses motivational interviewing strategies that provides some simple advice and some feedback about risk? Or is it a motivational brief intervention that's focused on trying to help motivate someone to take the next step to link to care, to deliver the adolescent or young adult to care, and that's the RT piece of it. So we talk about all components of the model. In addition to this, which not on this actual model, is the follow-up care. How do we follow up? How do we deliver warm transfer, warm handoff? How do we do that properly? How do we follow up with young people? How do we engage parents or guardians? What are the confidentiality and privacy issues? So we really try to extend this model full on to the full continuum of care around screening and brief intervention. So SBIRT aims to do a number of things. Primarily, it's to increase early identification of patients and clients at risk for substance use problems, to build the awareness and to educate patients and clients on the guidelines around what is risky drinking and what are the risks associated with substance use. With adolescents and young people, we talk a lot about there are brain development risks that we don't always talk about with adults. So we're really trying to create education awareness that is developmentally appropriate, things that young people care about, and trying to help develop education and curricula that really does mirror what a brief intervention looks like for a young person. And the things and the risks that matter to young people are not the same that matter to adults. So we're really having to tweak it, you know, how we talk about it, but it really is about trying to build some awareness because many young people are not aware and they're not always eager to talk to adults about their substance use. We also hope that we will be, you know, engaging adolescents to motivate them to take some steps to reduce their risk. It could be cutting back, although we would like young people to abstain. In this model, we want to reduce their harm and reduce their risk, and sometimes taking steps towards that may be what the goal is rather than abstinence, even though we know that is what the recommendation is. And then try to adopt health-promoting behaviors or engage in other activities, sometimes it's social, that are less likely to put them at risk. And then to motivate individuals, young people, young adults, and sometimes we're engaging their parents or their guardians and helping to seek additional care, deliver them to care, increase access to care for those who may have a substance use disorder. And then to foster a continuum of care that integrates prevention, intervention, and treatment services. And so really addressing substance use as part of addressing the entire health of the adolescent patient or client. So why SBIRT? I won't go into all of these, but these are just some of the things that we know are connected to substance use among young people, young adults, and adults. These are things you've probably seen, safety issues and injuries and accidents of young people, lower school performance, lower productivity. There's lots of different reasons why we might want to use screening and brief intervention to address risky substance use. We hope that it will hopefully intervene early, prevent overdose and death, prevent moving people to a risk level where they're engaged in sexual risk-taking that may avoid exacerbating a health condition that they already have. And so these are just some of the reasons and some of the things that we hope, and we have a lot more research to do to find out, do they actually move these things? The literature in the adult population suggests that we have the potential of reducing these risks by using screening and brief intervention. But there's much work to be done in adolescents to know how we are moving that needle through screening and brief intervention. So there are many recommendations and guidelines on adolescent screening and brief intervention. Here are some of the leading professional associations and government agencies: the American Academy of Pediatrics, AMA, SAMHSA, CMS, and IAAA, who have endorsed the use of screening and brief intervention with adolescents. The interesting thing is, though, The list of endorsements and guidelines is extensive, goes well beyond these 5 associations or agencies. The interesting thing is there's been very slow uptake among health professionals, a broad range of health professionals. This is just something the American Academy of Pediatrics found, was that fewer than 50% of their AP-affiliated providers actually screen adolescents, and then only 14% of young adults who reported exceeding the alcohol consumption guidelines and visiting a health professional actually asked about their alcohol use. And you see this in a variety of places in the literature suggesting that we aren't routinely screening, even though that is the guideline and the recommendation. So we still have quite a bit of work to do in many different settings where adolescents are, not just in pediatric offices, but there are a lot of places where we could be doing screening and brief intervention. So health professional education efforts really have been slow, but I have to give a lot of credit to SAMHSA and HRSA and CDC and others. The federal agencies have really been trying to do a lot more in pre-service education, educating the next workforce, and also educating the existing workforce through the National SBIRT ATTC and the other ATTCs that are a part of that network. Social work, nursing, and other health professionals need to be prepared to work in a range of settings where adolescents and young adults receive their care. It's not always in primary care, and where SBI is being implemented. And what we know is that social workers and nurses are working in a lot of different settings. We always think of nurses in hospitals and nurses in primary care, but nurses are in a lot of different places. Social workers are in a lot of different places. And we presented this slide to folks at ACN and at CSWE, and many said, yes, we're in all these places. This is actually where SBI is happening in the work that I do and my colleagues do. We were able to identify these places. And so I think this is really a place, this is an opportunity to see, yes, our students are going to be working there, our practitioners are working in these places, and we need them to be prepared to do screening and brief intervention in those settings. But there are a lot of common barriers in educational settings that we've learned from doing our needs assessment, doing our interviews with our different stakeholders, that there's lack of time to really add something else to the curriculum. It's not required to teach substance use education. It's not an accreditation standard, and so we're teaching often to accreditation standards, and if it was, we might pay more attention to it, is what someone told me. There's a lack of awareness, skills, and knowledge about substance use prevention and early intervention, and SBI specifically. So just needing the educators and instructors to be more prepared. They don't know where to start. So they tell me, we don't know what to include, we don't know what the educational resources are, we don't know what the teaching materials are available, do they cost something, where would I find them? Not sure where it fits. They ask me, is it a separate course? Is it woven into multiple courses? Do I need to create an addiction-specific course? Is it a more general course? Should it be an elective? What should it be? Should it be required? I think it should be required, and I think it should be woven into multiple courses. There's many ways to make the connection between screening and brief intervention and many different topic areas that are taught in both nursing, social work, and other disciplines. And then we heard from our learning collaborative and from our steering committee that there's a lack of engaging visual learning opportunities to supplement lecture and didactic content. We have a lot of digital natives, people that are very technology savvy. They want something more engaging than PowerPoints and lectures. Then we have the substance use education is geared really towards persons with substance use disorders right now. We really haven't talked a lot about education and curriculum prevention, early intervention for risky, unhealthy use. Mainly taught in psychiatric mental health courses. And there's really limited time and exposure of substance use generally in the curriculum, and even less so with adolescent substance use. And then there are a lot of competing demands and lack of resources, expertise in the area, and materials. So those are some of the things that we've heard. Here are a couple of other things we've heard around implementation and administration challenges. The demand from the healthcare field for SBIRT knowledge is growing, but the demand is inferential and anecdotal. So we're hearing a lot about it, you know, in the communities, in schools, in criminal justice, in our federal agencies, all over the place. We don't have a systematic way of knowing what the demand is, but there's a lot of inferring and a lot of anecdotal evidence that there is a demand for it, and you're seeing more of that as we talk more about ACA and integrated care. Also around implementation and administration, we've heard that there is a lot of interest in learning collaboratives to have that shared learning, and particularly in and we have other learning collaboratives, other agencies have learning collaboratives that are interested in SBIRT, and the work that AACN and CSWE are doing with the nursing consortium and the social work consortium that are collaborating, those are much like learning collaboratives. There's really is interest in SBIRT and interested in integrated care. And SBIRT is often integrated in integrated care kinds of learning collaboratives. We also heard from the needs assessment of the learning collaborative, educators suggest that respondents plan to provide much more training in the near future. They felt like there were now becoming more materials. There was hope that more materials and resources, that the association seemed very supportive of this, and they reported to us that they plan to do more in the near future. So there's something tipping, something moving in that direction, especially if there were clearly identified, validated brief screening tools that they could educate students on, and that they knew what the brief intervention models were, what were the adolescent issues, how do you actually deliver this? And so by having the tools, they were reporting they felt like they were more ready and likely to actually put it into practice. We also heard that implementation of SBIRT training in schools of social work and nursing has implications for the overall curriculum. But figuring out, is it standalone or is it part of an integrated curriculum? That's what the questions that have come up with us is, where does it fit there? Do we talk about it in policy, in clinical? Is it taught together, separate? Because there are policy issues around it. There's also billing and reimbursement issues around it, all sorts of issues. So how does SBIRT fit when we're talking about the implementation and administration of it? We also heard in social work that SBIRT training can be tied to core social work values and beliefs, social justice, prevention, access to care. And in nursing, we heard that SBIRT training can be and should be perhaps tied to providing routine nursing health care, not specialty nursing health care. And then the healthcare community sees social work and nursing as the logical professions for implementing SBIRT and creating health. That's something that we've also heard. And our social work students being prepared to speak the language of health. And we heard from nursing, our nursing students being prepared to speak the language of behavioral health, which is where often SBIRT fits in. So I just want to let you know that we have lots of resources that are available to you. This is the website I was talking about, where you can get a lot of information on on-demand learning, implementation guides around screening and brief intervention, case studies and role plays and videos and evaluation measures and articles. I hope you'll take advantage of all these free resources and the different websites that you can enter into through that portal. And I would also like to mention to you that through this initiative, we have now released the Adolescent SBIRT curriculum. The website, the sbirt.webs.com/curriculum, it is now available. You can request an electronic copy, and that will be made available to you. It's the full curriculum. It's a learner's guide, plus the PowerPoint slide deck that can be used to educate the students and the preceptors and the field instructors and whomever you would like to educate. We have a lot of downloadable resources, suggested readings. We have a syllabus. We have evaluation measures. And if there's something that you want that you can't find, you are welcome to contact us, and we can try to make that available too. We also, as I mentioned, the Adolescent SBIRT curriculum includes the simulation program, and that is available to be licensed through Cognito. And we're fortunate enough today to be able to have Cognito and Cyril Adam with us to be able to talk about the interactive simulation training platform as a learning tool. So I'm going to introduce Cyril briefly and let him, then I'm going to turn it over to him. So Cyril Adam brings 10 years of experience in instructional theory, design, and research to Cognito's health and wellness applications. As a Senior Director of Health Programs, Cyril Adams manages the development and dissemination of virtual patient simulations for health professionals, such as the SBI with Adolescents program, a simulation which is really focused on adolescent substance use screening and brief intervention that's been developed in partnership with NORC, AACN, and CSWE, and our Learning Collaborative. Mr. Adam developed health and technology projects at the Columbia Center for New Media Teaching and Learning, and within UNICEF Polio Eradication Initiative, the world's largest public health campaign. With strong expertise in using technology and virtual environments to improve health behaviors, Mr. Adam works with Cognito's research and instructional design teams to continuously improve Cognito's simulations and to bring engaging, effective solutions for health professionals to prepare for conversations that matter most. So I'm going to turn it over to you, Cyril. Thank you, Cyril, for joining us. It's your stage.
Thank you, Tracy. Thank you all for joining today. It's a privilege to be here and to have been engaged in this project with NORC, with AACN, and CSWE. And I'm very, very happy to be able to tell you a little more about our project today. So the reason Cognito became involved in this project is that we create digital experiences that prepare people for the conversations that matter most. Those conversations, we think, are essentially conversations that have to do with physical and emotional health and wellness. And I think through Dr. McPherson's presentation, you really heard how important those conversations with adolescents around substance use are and how effective they can be at driving changes in behavior. Our digital experiences are digital simulations, like you can see on the right of your screen, with virtual humans, and they enable you to go in and play the role of a health professional, for example, and engage in a practice conversation with virtual patients or clients. We have developed a number of these simulations, and several of them are listed on SAMHSA's National Registry of Evidence-Based Programs and Practices. All of them are developed using the same approach that we'll discuss today, where we don't develop these for you, but we partner with the stakeholders, with the practitioners and associations involved in the field to really inform the subject matter and to really complement the technological abilities that we bring to the table. A question we often hear is, why virtual humans rather than video characters? There has been 30 years of research into virtual humans, and we also bring our own experience here. Research has shown that people are very comfortable interacting with virtual humans. They do not feel the presence of a physical person kind of judging them a little bit or their performance in the conversation. They're very comfortable disclosing personal information. So virtual humans really create a safe space for students and practitioners to engage in these practice conversations. Virtual humans are also less likely to remind you of someone you may have known in the past and that you may have certain emotions associated with. And finally, as I mentioned, these simulations really create a private space where students can on their own time, practice those conversation skills without the fear of judgment from their peers or an instructor. So having that private space to practice is very important. And finally, I want to draw your eye to the Choose Your Avatar option at the bottom of the page. That's a feature that we implemented in this simulation, where learners can choose whether they want to play as a nurse or as a social worker. Our methodology, as I said, is informed by neuroscience, social cognition, and adult learning theory. We come from the principle that adult learners really need to have a lot of control over their experience. As Tracy mentioned, we are also addressing the incoming workforce, younger people who are, in many cases, digital natives who grew up surrounded by technology and very accustomed to interacting with digital technology, and in many cases, virtual characters. And so we want to put them in an experience that reflects the setting in which they are going to practice. And we put them in conversation with virtual humans that really reflect the patients and clients that they will see in their practice and that have their own personalities and memory and are emotionally responsive to what you will say to them. And so in this current project, our goal was to create a simulation to let nursing and social work students and practitioners practice having screening and brief intervention conversations with adolescents. 4 learning goals. First, learn how to screen adolescents using validated tools rather than coming up with your own questions. 2, apply brief intervention models and motivational interviewing. So the brief intervention model that we use in this case is the brief negotiated interview, which is an evidence-based conversation model for brief interventions, and motivational interviewing, which has proven to be effective with people with alcohol use disorders, but also a range of other substance use and conditions. Number 3, make collaborative action plans with patients. And number 4, provide treatment referrals and coordinate care. And as I mentioned, learners are able to choose the role that they will play in the simulation. They will go through a series of interactive modules to teach them a little bit about SBIRT and some of these techniques. And then they can practice with 2 virtual adolescents and finally assess their skills in conversation with a 3rd adolescent. So without further ado, I'd like to show you the actual simulation. Just to set the stage here, this character on the right of your screen is Josh. And Josh, there was a brief introduction to this conversation where we learned that Josh injured his ankle while he was at a party with some friends celebrating. Josh jumped off a rooftop and landed in a hot tub, which he thought would be a good idea, and kind of got him into trouble. And so once his ankle is taken care of and his intake screening has been done, and we've seen that that Josh shows some moderate alcohol use. And so your role as the nurse or social worker will be to engage in the conversation with him and to try to motivate him to first talk about his substance use and then adopt more protective behaviors. A few items on your screen at the bottom here, you can see your brief intervention checklist, which at any point in the conversation will show you where you are and what your goals are. So the first step of a brief intervention, or the brief intervention model that we use here, is to build rapport with the patient. So instead of going right away into talking about substance use and how, what Josh might do differently next time, we might want to ask him a little bit about his life and get to know him, ask him for permission to raise the subject of substance use, and then bring up Josh's own substance use. So a set of really good pointers here to engage in this conversation. On the right, you can see Josh's engagement meter, which you will see move throughout the conversation and which will give you an indication of how responsive he is to the way you are leading this conversation. This helps sort of translate the body language and the verbal reactions of the virtual patient or client for those who may not have as high an ability to interpret those. Finally, in your top left corner, you can use the talk button to actually talk with Josh. And you will have a few choices. Here we can raise the subject of substance use, we can give Josh advice, or we can ask about his life. And within each of those, there is a range of effective or ineffective tactics to do this. So in the first instance, we can thank Josh for filling out the questionnaire, and we can ask him for permission to talk about substance use. Or we can choose the second option and say we need to talk about your answers to the substance use questionnaire. So being a lot more directive with that. So let's see, let's pick something that is a mistake that practitioners often make, especially inexperienced practitioners, and jump into giving Josh advice and advise him that his drinking is dangerous for someone his age.
On the form you filled out, you said you regularly drink.
And here comes the lecture in 3, 2, 1.
I don't want to lecture you. It's just really dangerous for someone your age. I mean, look at what happened today.
Oh my God, you're right. It'll never happen again. I'm so glad you were here to set me straight.
Okay, so as you can see, Josh, or as you can hear, Josh very much is a typical teenager and responded very honestly to our advice. And here the coach is informing us that we jumped into giving Josh advice without building any rapport. And so we will undo that choice and try again. I'm sure this is something that a lot of you wish you could do in real life now and then take back something that you might have said. This is a great feature of the simulation that helps students really experiment with a variety of techniques to figure out what is effective or what is ineffective. So we can continue talking with Josh and ask him about his life. So I think we should learn a little more about what exactly happened to see what role alcohol might have played into it.
Seems like you had kind of an interesting night. How did you end up on the roof?
I already told the lady at the desk. Doesn't your form or whatever have that?
I'd like to hear it from you.
We were hanging out at a friend's place partying, and some of us got in the hot tub. And I thought it would be cool to, you know, if I could jump in from really high.
Okay. And when you say partying, what do you mean?
You know, drinking a few beers and having some fun.
Okay, so we asked Josh a couple of open-ended questions, and we saw that that really helped him open up, and he actually gave us a lot of information about what happened at the party. So we can continue to ask him a little more about the party, or we can raise the subject of substance use. So let's try to raise the subject of substance use in the interest of time. And again, we can ask him by thanking him and asking him for permission, or we can say we need to talk. So let's see how he answers both of those, starting with the more directive one.
I saw your answers to the substance use questionnaire about alcohol and drugs, and we need to have a talk about it.
Here it comes.
And that felt a little bit pushy to Josh. And so again, the coach will invite us to undo our choice, go back in time, and try a different option. So let's try thanking him and asking for permission and see how Josh reacts.
I noticed you filled out the questionnaire about alcohol and other drug use. We ask all of our patients to complete that. Thank you for being honest on it. I'd like to talk with you for a few minutes about your responses. What do you think about that?
Oh, okay, I guess.
We can really see that how differently the patient reacts to the different approaches that we might take. And here I want to draw your attention to this little thought bubble above Josh's head. We can click on this and actually hear what he's thinking at that point. So let's see what he's thinking right now.
I didn't think anyone would look at that thing. Maybe I shouldn't have been so honest.
Okay, so we asked Josh about the substance use questionnaire that he filled out, and he's already expressing some concerns around privacy and wishes he hadn't been so honest. And this is something that will come up several times in the conversation, and that will give you plenty of opportunity to address those privacy concerns with Josh. So let's ask him a little more about tonight's party and see what he has to say.
Tell me more about the party tonight. What were you doing before you hurt your ankle?
You know, drinking and goofing around.
How much did you have to drink tonight?
A 6-pack.
How typical is that for you to have 6 drinks?
Well, I guess tonight we partied pretty hard. We won our football game on Friday. The team usually parties together after a game, and when we win, that makes it even better.
Were you using anything else at the party? Any other drugs?
Nah, it's just drinking.
Okay, so you can see that Josh is really opening up with this approach. We can see that our engagement meter is going up, and that we're doing a good job of engaging Josh so far. So let's try and get a little more information about how he thinks alcohol might be a factor in his injury. And again, we can, ask him a little bit about the party, or we can ask much more pointed questions about, how much he drinks each. So let's try to help him relate the alcohol to his injury and see if he might be able to make a connection there.
So how does alcohol factor into the accident tonight, if at all?
I figured you were going to ask that. Look, am I going to get in trouble for writing that stuff on the form, or for telling you any of this stuff?
Everything you tell me will be confidential, unless I hear that you're harming yourself or someone else, or you tell me that you've been a victim of abuse. I'll keep our conversation about your alcohol use between us, unless you agree to include your parents.
Okay. Well, I was drinking a lot, so I guess you could say it was a factor.
Okay, and once again, Josh expressed those concerns around privacy, and we were able to reassure him. So I'm going to go back to the slides now. I just wanted to show you a snippet of this simulation so that you could see what the experience feels like. I hope that it plays pretty smoothly over GoToWebinar. If you experienced any delay, feel free to reach out to any member of any of the organizers of this webinar, and they can send you a link to the full experience. So those practice conversations, we just saw Josh, and I just want to go over the different conversations that you'll be able to go into with this simulation. So we just saw Josh in a hospital ED. He has an ankle ligament injury. And we learned about what happened at the party and his screening results. We will then be able to speak with Emily, who is in a school nurse or social worker's office where she was referred by her teacher, who noticed that she had been a little bit distracted in class. And her screening results show weekly use of marijuana. And so your role will be to engage her in a conversation around that, where you will have actually a very interesting conversation with Emily about the role that some of her family dynamics may be playing in her recent increase of substance use. And finally, you will be able to speak with Kayla in an assessment conversation. So here we are going to remove the training wheels a little bit. You won't have the undo button. You won't have the engagement meter at the bottom of your screens. You won't have access to the patient's inner thoughts. And there is no acute condition here. Kayla comes into a primary care setting for an annual well visit. So there is no acute condition, as there was in Josh's case, to relate to her alcohol use. So you will really have to work with her to draw that out and get her talking about the pros and cons of her substance use. At the end of that conversation, learners receive a summary dashboard, which you can see on your screen, where they will receive an overall score, as well as a score for their use of a motivational style. So the way this scoring was developed in conjunction with our subject matter experts was essentially to translate the live observation forms that are used by faculty who observe their students in role plays or standardized patient experiences, and to translate those tools and the competencies that they include into this scoring system. And so learners will be able to then see a full breakdown of their performance in each section of the conversation. And here you can see 4 of the 6 sections: building rapport, eliciting pros and cons, providing feedback, assessing readiness, and so on and so forth. And they will be able to see line by line what they did well or not well and receive feedback on each section, as well as options to revisit some of the content in the simulation. So here the intent is really to provide deliberate practice over time for those students, provide them with a simulation that is not just a one-time experience, but that they can return to anytime they want to try and improve their score. We know that deliberate practice over time is what will drive competency and skills, and learners' ability to transfer those skills to whatever setting they practice in. So again, I'll be happy to provide, to answer any questions about this simulation. I'm going to turn it back over to Dr. McPherson, who will, I believe, lead us through the Q&A.
Thank you, Cyril. That was terrific, a great demo. It's really nice to see, you know, the different ways in which it could be a nurse or a social worker or another professional who can, you know, identify coming in what kind of practitioner they are, and they have different types of scenarios. And you have social workers working in hospital settings and acute care conditions. Sometimes they're brought in to do these kinds of services, and nurses and social workers are working side by side in a variety of other settings. And it's nice to have a tool that, regardless of the discipline, you're able to really practice the skills and get the skills which are the same for both professionals. That, you know, it's the same skill set, and so that was really fantastic. I appreciate that, and it's nice to see how it, you know, how it generates a scoring mechanism so that you can look at fidelity and competency. And it's one of the things that actually was new to the project, because the Learning Collaborative and the steering committee and all the stakeholders said, you know, assessment of skills is really important, and how do we know how our students are performing? Having practice conversations, having a conversation that does do that kind of assessment and mirrors the way that they assess using what they call brief intervention observation sheets to score certain types of skills. It's nice to see that integrated into the program. So that was a surprise to our project, and one I think is very, very welcome. So thank you for that. I want to now open it up to some questions. I'll just remind you that the questions pane is over to the right on my screen at the upper right-hand side. You can just simply type in your questions. We have a couple of questions, a few more coming in, but we don't have a ton of questions, so you're likely to get your question answered if you want to get it in. So the first question that I have here is for Cyril. So is there a limited number of verbal options that the counselor or the practitioner can ask in these scenarios?
So as you saw, that's a great question. Thank you, Dr. McPherson, or thank you, whoever asked the question. So as you saw in the simulation, you have a limited number of choices every time. And there are several reasons for that. The major reason is from an instructional point of view, because we are addressing many learners who are completely new to these substance use conversations and to motivational interviewing. We felt that it was a little too high of a bar to ask them to formulate reflections or affirmations or other motivational interviewing techniques. And so constraining the choices really allows students to experiment with what might be effective or ineffective without kind of getting lost in, you know, trying to formulate those sentences themselves. A first order skill is to be able to identify or recognize a specific motivational interviewing tactics, and then a higher level order of skill would be to be able to formulate those. So we think this is a very appropriate tool for really both novices and those who are a little more experienced but maybe new to substance use conversations.
Great, thank you. Let's see if there are any other questions about the simulation software. Yes. Does everyone have access to the simulation software? Is it on the website? I'll take a first stab at that, Cyril, and then you can jump in as you need to here. So through the Learning Collaborative, we have, I mentioned earlier, the request for application or the RFA program. You submit an application. We offer stipends up to $10,000. We right now have 22 schools are participating in that, or 23 schools rather, and they are actively using, and we're evaluating it in the program, evaluating the program in the RFA program. In addition to that, there are other folks. Some are SAMHSA grantees, some are non, some are just other schools, other programs, other agencies who are licensing it outside of the project or outside of the RFA program. So, Cyril, did you have any other comments about that?
I think you covered it really, really well, but I just wanted to add that we've had a lot of interest beyond schools of health professions from professional associations that are interested in making these experiences available to their members, as well as from health settings. Hospitals or primary care networks have also seen a lot of relevance in this simulation for their own practices. So I think this speaks to what you were saying earlier and the fact that it's very applicable to not only students but also current practitioners.
Great, thank you. And then how long is does the demo, they're calling it a demo, but the simulation, how long does the typical simulation take to complete?
Simulation takes about an hour to complete, and I should mention that it is accredited for both nursing continuing education credits and social work continuing education credits, and we also have medical education credits pending, so those should become available soon.
Okay, let's see. Is there a version available for adults? That's the question for you, Cyril.
There is actually. We have a couple of simulations that cover similar competencies for adults. At Risk in Primary Care is a simulation we built a few years back, in which covers both substance use and mental health screening and brief intervention. And we just launched in January an assessment module, which is a 30-minute module and its purpose is to assess the skills of students or practitioners to screen and conduct brief intervention.
Great. And if they wanted more information about the cost, who would you suggest they contact? My first stab at this is that if you go to the sbirt.webs.com website, which is our project website, and you go to the curriculum page, on the curriculum page is a flyer, basically, that will describe the simulation and the features, and there's contact information for Cyril. So we've put that up for your convenience, and you can download it. And I'm directing everyone who's not participating in the Learning Collaborative to use Cyril. But certainly if you're in the Learning Collaborative and you want to learn more about the RFA program, how to get access to it that way, or if you don't want to do the RFA program in the Learning Collaborative, how might you license it? I would say you can contact the SBIRT team at norc.org or Cyril, and we can respond to your questions. Do you have anything else to add to that, Cyril?
Not at all, Tracy. I think the project website is a great place to start, and of course, anybody on this webinar should feel free to send me an email or give me a call if they have any questions. But I agree that the website is a great place to start.
Okay, great. And then are there, I think this is probably directed towards me, are there schools of social work in Michigan whom are participating in the Learning Collaborative? And is there a list of schools in social work, public health, or nursing located in Michigan or participating in the Learning Collaborative? I can tell you that there are schools in Michigan participating in the Learning Collaborative. If you want to send the SBIRT team, so sbirtteam@norc.org, an email, they can forward it to me, and I'd be glad to reach out to that school and ask them if I can share their contact information. Typically, they always say yes, because this is about learning and connecting and sharing. We have a very robust, program underway in Michigan that I think would be very delighted to talk with you about what they're doing. And they may know more about what's going on in Michigan. That particular program is in nursing. There are others that are also Michigan in social work. So feel free to send an email, and we'll connect you offline. All right, there may be just one more question. Let's see, do nurses get reimbursed for SBIRT? I would encourage you to go to the National SBIRT ATTC website. You can type in National SBIRT ATTC and type in reimbursement map. There's a map of the United States. You can click on your state, and you can learn more about what reimbursement is in your state, who, how much, as much of the information as we've been able to gather, and things do change over time, and it varies obviously from state to state. I would encourage you to go there to learn more about reimbursement. And I think there is a question by Ms. Ward about integrating it into their grants. I think this is the last question. Awarded a grant to integrate SBIRT, and they are interested in using the simulation program, and they're trying to think about ways to maintain the program after their grant, and would be interested, perhaps Ms. Ward, talking to myself or Cyril about what we're learning about how other schools are planning for sustainability. How will they continue to use the simulation in their programs after their grant is gone, and how they're covering the cost. If you want to email Cyril or myself at the SBIRT team, we'll be glad to give you some ideas. There are several different models that we're hearing that schools will be and are considering, and be glad to talk with you about how they're considering it. So I am going to close the Q&A period. If you have other questions that you weren't able to ask, you're welcome to email us behind the scenes and ask those questions, and we'll be glad to respond to you. So in the last few minutes, I just want to remind you that we have an evaluation survey, and I can't stress enough the importance of our evaluation survey. If you are attending this live event, there is an evaluation link over in the right-hand side of the panel that our technical facilitator has put up for you. We also have a link from our website. It's really important to maintaining our funding, to have those completed by you, and to be able to provide you with a quality education and the kinds of webinars we're able to provide for you today. If you are going to share this with your colleagues or listening to this on demand, once it'll be available within about 24 hours, after you complete the on-demand recording, we ask that you go back to the website and click on the on-demand evaluation survey. For those in the live event, you will have a follow-up email about where to access the materials. You'll be able to request a certificate of completion from our website. The follow-up email will also go into that as well. But we encourage you to go to this website to access all of that, and most importantly, completing that brief evaluation survey. So I'm going to thank everyone for their time today and remind you to share information about all of the webinars in this series, and also to take advantage of them being on demand and freely available to you. I'd also like to offer that if you're interested in more questions and have more questions, or interested in SBIRT implementation, evaluation, and training, and you'd like to schedule a free telephonic technical assistance call with me, I'd be glad to do that with you. You can just email me directly. And last but not least, I will thank everyone. Thank you so much for your participation today on this webinar. I want to thank our presenters who offered some wonderful information about what they've been working on in their associations and what they've been doing in our partnerships together with NORC, and to look at the, and to encourage everyone to take a look at the curriculum and the instructor's toolkit and more about the simulation available from our website, and get involved with the Learning Collaborative. So thank you very much for attending, and please join us in our future webinars.